Children are some of our most vulnerable in our population, but yet they are the ones that are victimized the most.
Victims advocates tell us that the real number of abuse cases is likely much higher since many are never reported.
Sexually abused, dangled upside down.
We continue our coverage on that disturbing child abuse case. 2 adoptive parents arrested for the abuse of
punished him by withholding food and locking him in his room, not even letting him out.
The child misbehaving isn't a reason to abuse the child.
A new disturbing case of child endangerment.
Sometimes I still have nightmares of things that had happened.
My parents took my whole life from me.
You hear stories about kids that come from different demographics and backgrounds, but you don't realize how close to home it is.
Our kids are at the home because they come from a very dark place. They come from a place that we cannot imagine. A place of hurt, a place of pain, a place of pure trauma and torment. And this isn't just, oh, you know, I spanked you. This is, I beat you until you were unconscious. This is, you know, not a touch. This was, I sexually assaulted you and sodomized you. This is what our kids have been through.
I'm here because the situation that I was in was really bad.
I am here for suicidal thoughts and past trauma.
It's because I had a negative attitude and I was threatening my foster mom.
We got separated because our real parents been abusing us. I came here because there was no place to put me in except for here.
I ran away from my last foster home.
My dad, he abused me.
How could someone do this to a child? But yet, we are here for these children, and we are going to receive them, and we're going to give them everything that they need to take them from those very, very dark places and help show them the future, a bright future that lies ahead of them. When a child comes to us for treatment in our residential program or our emergency shelter, once they walk in the doors and they transition, that's when the healing begins.
Realizing that even though they've been traumatized, that they're still a baby, they're still a human, that they still matter.
When you try to build relationships with them, sometimes they push you away because they're not used to that. It's like a test to see if you're gonna stay around.
Because it's like, okay, you're being nice right now, but if I do something else that's not right, are you gonna still be nice?
And then slowly, as time goes on, as days go on, the minutes and the hours pass, you begin to see that smile that turns into a laughter, that turns into laughing with joy and laughing so hard that their stomach aches and laughing with tears. And then you see the kid. You see that hope, you see that love, you see the compassion come out of that child.
In Kozer Charity's Pediatric Convalescent Center, a child, once they become a resident and they begin receiving activities, therapy, compassionate nursing care, you know that the miracles are beginning to happen when the child begins to engage with our team member.
No parent can be a physician, a nurse, a respiratory therapist, a CNA, an OT, a PT, speech. You can't do all of those things. The children's medical needs just become too intense. And so they come to us for long-term care where we take care of them and allow the parent to resume that role as parent and loved one. We strive to make every day exceptional for our kids because we don't know, unfortunately, when their last day will be. And so we always ask ourselves, what are we doing every day to make this day as meaningful for the resident as possible?
In Open Arms Children's Health, when a parent brings their child in for a doctor's appointment or a dental appointment, or maybe they're having their hearing checked, you know that a conversion has happened because the family walks in, they know the staff that they're working with, and they begin to see improvements in their child's health.
So Open Arms Children's Health is a pediatric integrated health center servicing all kinds of kids. A great thing about Open Arms is our ability to service patients with all different kinds of needs. Open Arms in the last year has opened an outpatient therapy center. They offer occupational therapy, speech therapy, physical therapy, psychology services, and it's great that all those services are in one place so that when the patients come, they can get everything taken care of at one time. Each individual service that we offer, sure, it's one type of service, but when you bring it all together, it's the heart of our city.
Each interaction that our team members have with a child and then the family that's in the background, we're really preparing them for the future. And so we really open the door for them. We shine a light into what the future has to hold for them, and we give them confidence, we give them skills, we give them everything that they need from a resource perspective to leave us and go into tomorrow in a better place than which we found them.
One of those things where you feel like you're sending a little piece of yourself out with them, and that you hope that you instilled something positive in them while they were here and you had the opportunity to.
To see a kid put in the work and actually become successful when they leave here, and you know they're going to be, that's what makes the job definitely worth coming back.
This is a place unlike any other that I've ever been. There is so much happening 24 hours a day here. At the heart of it all are these children, and that everything everyone does every day we come to work is for these kids.
I let each one of them know when they leave that if anyone says you can't, yes, you can. You can do anything. You can follow your dreams, go with your goals. Don't let anyone stop you from achieving.
We are the saving grace for our city because we save so many. The lives we touch, the kids we touch, they're our future, and they brighten the city, the world, the places that they're gonna go because we love them here at Home of the Innocents. It's endless.